Let's take this discussion further. I have joining me on the news at 10, the Chairman, Association of Public Health Physicians of Nigeria, Lagos Chapter, Dr. Doyin Odubanjo. Thank you for joining us on the news at 10.
It's a pleasure. Good evening.
Good evening. A happy new year to you.
Same to you.
Let's get your reaction on the suspected outbreak of polio in Cross River State, as we have seen in the reports before now. How much of a setback could this be for us as we strive to achieve polio-free status?
Well, I think we shouldn't, first and foremost, we shouldn't rush to conclude. We should wait for the test, really, because you can't tell just by looking to say this is polio. So we need to wait first for this test to come out, and then we can start talking about how bad this is. If it is confirmed, it's really bad, because that means we have to wait longer before Nigeria can be declared to have eradicated polio. And that means we have also set back the global agenda. Perhaps by many more years.
But this will not, this acquisition of the status will not be dependent on Cross River State. This is in combination with the cases that were discovered last year in Borno State, right? Right,
but then it's about timing. You know, so if you look at what was discovered in Borno, they start counting from then to say we don't have any more cases from XY date. You know, but now we have a later date of a case. So if it is confirmed, then you start counting from now, not from when you saw the last case in Borno.
Okay.
Right.
Now, supposing the results, as the Commissioner for Health in Cross River State has said, supposing the results turn out positive, you know, at the end of the day, after the analysis and diagnosis has been done, what should be done from there?
It means it's back to the trenches. We have to go back to all of the same strategies that were being used. You have to have mop-up vaccination campaigns around that vicinity. And indeed, it also means that we need to further check what we have been doing around there. Because basically, it looked like what we had concluded before was that the main problem was from the northeast, which we didn't know much about, given the war in that area. But if we have now in the south-south, then it raises new questions about what we've been doing and what we need to do now.
And that also raises the issue of primary health care, as you know, some of the responders in that in some of the reports that we just listened to also talked about some of the facilities that are missing, you know, in these institutions. How did we get to this point where our primary health care facilities are actually lacking basic infrastructure?
I think it's a question of priorities. You know, in Nigeria, we pay a lot of lip service to health care. Care has been important. But it's not as important as we say it is to us, really, because it's like, again, taking the war against terror in Nigeria. We thought it was important, we said it was important, but we can tell the difference between last year and this year when we really know that it became important. You know, so it's the same way. Over the years, we've said healthcare is important, but all of us can tell appalling stories of facilities, equipment, human resource, at health centers close to us, wherever we live in Nigeria. So we haven't paid enough attention. Once it becomes priority for real, we will do all the right things because we know what to do, really.
You think this polio scare could help trigger that interest and push up the priority?
Well, that would be a good result. You know, if we did get that to trigger that, that would be fantastic. You know, Ebola didn't trigger it sustainably. It triggered something, you know, but it's not been sustainable. But I always like to use that example to say then we saw what happened. The political will, the funding, the equipment, we saw how things were being supplied, you know, to make things work because everybody was afraid and wanted to get away from Ebola. So the same way now, if this can push us really, it will be a fantastic result.
Dr. Doyin Odubanjo, it's been a pleasure speaking with you tonight. Thanks for joining us.
Thank you.
Dr. Doyin Odubanjo, the Chairman, Association of Public Health Physicians of Nigeria, Lagos Chapter.